Um,
Sorry, that's just me starting the recording.
I, I have to get that notice off my screen. So I wanted to thank Kat for inviting me to um, talk about my experience of being diagnosed, as well as um, connecting it with my profession. And so I thought um, I would discuss three aspects. One associated with the signs and symptoms of bulbar ALS. And since that's what my experience is, and um, and then to discuss um, hygiene needs and um, and the dental care team in there, how they can be part of your um, healthcare team to try to maintain your oral health um, at optimum levels. As you all are, I'm sure, aware, the journey that we're all on is um, has stops and starts as we progress, and as our difficulties increase, we need to make adjustments in our oral hygiene techniques and efforts. So I have some examples like that. So initially, I'd like to cover the um, upper motor neuron types of signs and symptoms that you may be experiencing already. But for the upper motor neuron signs, one of the more common early findings is slower tongue movements that then affect your ability to speak at the rate that you were used to. And that can be quite disconcerting, uh, as you can uh, tell from my what's called dysarthria, or slowing speech. Um, Another sign of bulbar issues is um, uh, facial strength weakness, where your muscles of your face are um, not maintaining the tonus or shape of your face because muscles fatigue, or they fasciculate, that type of experience. Another significant oral change is that your palate, your soft palate, which is the further back part of your roof of your mouth, it um, it starts to lose its ability to lift up when you speak or when you swallow food, and that can lead to some choking issues or coughing when you're trying to eat. Um, the um, the number one uh, thing for upper motor neuron symptoms is increased saliva flow, and that really affects our ability to speak because we have to manage that excess saliva, and it combined with our weaker tongue movement or strength can create um, what's called a dysphagia or a slowing of our speech pattern. And, initially, at least for me, when I hadn't been diagnosed yet, was quite disconcerting because didn't, I knew something was wrong, but I had no um, correlation with uh, it being PLS or ALS so I was in that phase of searching for answers. Um, the other thing that happens with that excess saliva flow is we start to slur speech. And so um, our care team may recommend medications to manage that saliva flow. But if they do so, the other side of that issue or coin is that with a drier mouth, we increase the risk of caries or decay of our teeth because saliva is the primary way that our mouth cleans itself. And so if we reduce the flow with medications, we increase the risk of caries production. So that can have um, uh, that should alter maybe how we uh, seek dental care. We probably should go more often um, so that we have a better um, management in case we start to see issues with caries production. The the other aspect that isn't as common for this group because this is a bulbar group, which is upper motor neurons, but the lower motor neuron ALS also has a couple of very specific signs that have dental uh, that affect dental care or dental concerns. And the two significant differences is hoarseness of the voice, and that's more common with lower motor neurons disease, and also poor lip closure, which with the excess elevation can then create drooling issues, which um, is always kind of frustrating when you're um, trying to, speak and eat and do, the normal things that we rely on our facial muscles and chewing the muscles of mastication and that type of dental stuff. So the next part that I wanted to talk about is oral hygiene. Does anybody have any questions about the bulbar signs and symptoms before I move on?
Uh-huh.
So not specifically towards the bulbar symptoms, but one that you might get to kind of in oral hygiene or pieces. Lynn asked, any ideas for bitten inner cheeks and lips and how to keep from biting?
Um, the yes, that's an issue that I experience periodically, and really the only thing that I can recommend is some form of a mouth splint or almost like a mouth guard that a football player would um, would use, just because it creates a barrier between the teeth and the tissue. So I bite my tongue frequently and my lips and cheeks occasionally. It kind of comes with the muscle spasming of our muscles of mastication, because there's 7 different sets of muscles that are used to move our jaw, our tongue, and our speech pattern. So, as we lose that control over those muscles, um, you know, we end up getting stuff in the way. As an example, yesterday I took a milk bath because I went to take a drink of milk, had a spasm in my arm, and had milk all over me. So, you just have to laugh about it and move with the times and accept the fact that you're gonna have a bit lip or a sore tongue here and there, and just try to slow down, take your time eating, um, and I will cover in the healthcare hygiene part a way that you can get a, a thing called magic mouthwash, which is something that a pharmacist can make up for you, and it can have some lidocaine in it that can help to numb some of the sores if you have a lot of problem with the oral sores. So um, I hope that's helpful.
Definitely. That's great. Um, there were a couple of other questions. Again, kind of about some specific issues with like, do you see trouble with clearing food from your mouth or trouble with being able to breathe in through the nose but not breathe out?
Yes, and so the breathing in and or out is a matter of your soft palate blocking because it's losing its muscle strength. A little trick that you can do that will give that more space is to literally thrust your chin forward so that your lower teeth are forward of your upper teeth, and that should open the nasal passage enough that you um, can get that breath to pass through the nose. If you Even while we're talking, if you try it, I think you'll see what I mean. So that's a way to overcome that in the instant that it happens. it's a little more difficult when you're sleeping or laying on your back. But um, but yes, I've had that experience myself, and it's from the losing of the muscle strength of that soft palate.
Thank you. Um,
Mhm.
and I think one more that, again, you may get to later. So if I'm jumping ahead, just tell me to stop. But Randy asks if there are any adaptive floss options.
Yes, I will cover those. I even have a few show and tell items here that
Awesome.
I brought. I'll bring up on my phone and show you the website type stuff.
Perfect.
So one, so I'll move into the dental team and oral hygiene stuff. Um, and I would say that the real star of your dental care team really needs to be your hygienist because she or he is trained in the um, use of uh, adaptive toothbrushes and rinses and fluorides and things of that nature for assisting you, whereas the dentist is really more of a, a source for addressing some of the muscle issues or the cheek biting or tongue, and the making of splints and things for trying to give you more protection um, of the soft tissues and teeth because um, for my personal experience, again, has been having muscle spasms of the muscles that control my jaw movement, and I end up um, hitting teeth with in an unusual angle and or with more force than I meant to, and that certainly could lead to tooth fractures and chips. And of course, any tooth that's chipped is going to, in and of itself, cause more sores to the soft tissues or tongue. So we obviously want to prevent that. And my personal prevention is utilizing muscle relaxers pretty much all day long to minimize those muscle spasms and fasciculations. Um, uh, One of the obviously we still want to use a toothbrush, but eventually our ability to control it diminishes, and at that point, I recommend moving to an electric toothbrush with a rotary head like that. Um, Only because it's smaller. And so it travels around in a circle versus um, up and down because it's hard for us to control up and down movement without injuring our soft tissues. The other thing is, I recommend a thicker handled toothbrush if you're still able to function with a toothbrush and you have the muscle um, you have the muscle strength and control to still brush with a regular toothbrush. If you need more help with your hands, here's an example of a toothbrush support for a hand.
Mm.
And most of these things you can find on Amazon, Walmart. Um, I have this is an example of how it connects on the hand
Mm. Mm.
so that it is still a, a manual way to control your toothbrush. As things get more difficult, you had the question of a way to maybe be more gentle. There's these little um, tooth jobs that are designed to, be very gentle on your tissues. The question regarding flossers is this is what I use, and it is quite simple to use. And they do make ones like this that have a longer handle, if almost like a toothbrush handle. And so, there could come a time when you just can't have the control it takes to go between each tooth. And at that point, you're really needing to look at, an increased care level from um, spouses or a caregiver. Um, so the oral hygiene requirements are, in my opinion, are really based on um, your ability and your care level. And that evolves as we go through this disease process. I thought I had a couple. Um, yes, here's also another thick-handled uh, type of system that you can increase your hand grab with. And then I have uh, also, there's one like this that's like a band that you can thread over your hand. So these are just some tools that are available, and your occupational therapist on your medical team should be, and or your hygienist should be knowledgeable on these things and could help you get them um, if you ask. Um, So there's one other one because is saliva flow. That's a big part of our bulbar group is that increased saliva. And so that as we progress, that can be um, difficult to deal with. And this is what's called a suction toothbrush. I hope you can see that.
Yep. And what I'll do too
And
is
so
I'll
it
grab some of these.
has the ability. Sure. But that is a way to draw some of the excess saliva out as you're brushing. What I tend to do with my electric is I lean over the sink and just let the extra saliva drop into the sink as I'm brushing and then rinse everything up. Um, so that would be a way to manage the saliva. Here's the other flosser I talked. Whoops. I just grabbed screenshots of these, but that's the other floss handle that's longer if you have trouble controlling it. And this one is different in that the floss is 90 degrees to the handle compared to the other one that I showed you. Um, so we talked about brush types, alterations. Frequency is important too. If you have excess saliva flow all day long, you can plan on brushing 2 or 3 times a day. If you start to take medications that reduce salivary flow, you really need to increase your brushing frequency to counteract the dryness in your mouth. That's really important to stay on top of that because a dry mouth can get severe decay in a matter of months sometimes. We see that often with drug addicts where in 6 months they have completely destroyed the enamel on their teeth from having a dry mouth and not doing any hygiene. In addition to the things I've shown you, there are also some prescription toothpaste that have much higher concentrations of caries reducing materials in them. And if you should talk with your family dentist about and hygienist about having access to those immediately and probably I use a prescription toothpaste with high fluoride content all the time, so that's really important. If you are having other problems with dry mouth, there are artificial saliva replacements that, again, your dentist or hygienist can recommend for you. One of them is called biotine, and another way to increase saliva is with a, a medication called xylitol, and there are some mints called xylomints that are also available for addressing dry mouth. I think I thought I downloaded. Yes, here's the xylomelt for dry mouth. But usually with bulbar ALS, we're always dealing with too much saliva and not enough. Also, these are biotine. Again, for dry mouth, these are rinses and sprays. So just examples. Um, and I recommend, early on talking to your family dentist about your diagnosis. And my personal experience as a dentist, and I did consult with several of my colleagues about our education in this area, and we really weren't, uh, it wasn't really on our radar and our training, but my experience of having PLS, which I originally was diagnosed as ALS, all of my earliest symptoms were all orally related because I'm yeah, upper motor neuron bulbar type of PLS. So I think you can be a teacher as much as a patient in regards to this disease with your caregivers, and especially in hygiene and dentistry. So I think I've covered everything I wanted to speak about, and I would entertain any other questions.
Yeah, there is another one that popped into the chat. How often do you recommend dental cleanings throughout the stages of ALS? And are there any resources to find an ALS aware hygienist?
I'm not aware of any um, ALS aware sources, but when Kat asked me to speak, the first person I called was my hygienist that worked with me for 17 years. And she jumped right on it and did all of the research for the products that I've shown you. And I think that's true of any uh, dental care team, is if you ask them that question, they will educate themselves to be of service to you.
Thank you. That's awesome. Leslie asks,
What was the other part of that?
oh, how often do you recommend dental cleanings throughout the stages of ALS?
Yes. So usually twice a year is normal. If you've had problems with dental disease, especially with with periodontal type issues or recession of tissues on your teeth, you should um, increase at least the hygiene appointments to 3 or 4 times a year, either every 4 months or every 3 months as you progress. The other thing I wanted to mention is you should assess, if you're like me and still fairly ambulatory, um, you should assess your access to your existing dental office. Make sure they have the ramps, that they have the widths necessary. I use a walker 100% of the time, or at least 95%. Um, and you want to make sure those wheeled those wheeled walkers have enough room to get in and out of the operatories, um, and that it's not making it difficult for you to access the care. So it's, we all have a sense of how clean we feel like where our mouth is. And if you can definitely tell you're struggling to keep things clean, then you certainly should increase the frequency of your hygiene visits. And that's a conversation that I recommend having early in your diagnosis with your dental care team.
Thank you. That's super helpful and I think very thoughtful. And um, I appreciate what you're saying too about having those conversations early and being able to kind of help provide that education before they may even need some of those pieces. I think that's really helpful to think about. Um, Another question that came in from Leslie is, what are your thoughts about like a water pick or water flosser device?
Um, the studies indicate that the water picks do not have the flow strength to physically remove plaque from a tooth structure. They are very good at removing food particles after eating, so I'm not saying not to use them, but do not rely on them to disrupt the plaque that forms on teeth that has a sticky uh, structure to it that has to physically be disrupted by a toothbrush. And so, the other point regarding the electric toothbrush I showed you is you should try to place it on each tooth individually, not to draw it across all the teeth back and forth. It's really designed to circularly clean one tooth at a time. So just the hygiene instruction part of how to use it.
And I'm sorry, can I, my clinic speech therapy brain needs to say something. My concern with water picks is that it shoots water really fast into your mouth, which makes it easy to choke on. Right? So then you're getting a lot of water really fast. And if your swallowing is impacted, then of course that's going to be a high risk of, so then you're dislodging food and shooting it right to the back of your mouth. And then the good chance you might choke on that too, or, get it down the wrong tube. So though I love to hear that was really good information too. Now I can use, that it's not as effective in clearing plaque. So I can use that as justification too. So thank you for that, Ken.
Certainly. Yeah.
Another question. Oh, go ahead.
No, that's fine.
Okay. I was going to say another question that popped in was that we've talked about feeding tubes a lot in this group before, specifically because we've had, because you noticed that change in swallowing and chewing and all of those pieces associated with it. Can you confirm that it's still important to do those frequent oral cleanings, even if you're not eating by mouth?
Yes, because the the plaque and the bacteria that cause and are held by the plaque continue to exist, and without removing it you're going to get into a issue with rampant caries or decay of your teeth, and that leads to pain issues and all kinds of complications that you just want to avoid. That's why I made a specific point to show that vacuum saliva toothbrush as a way to manage the water while you're still caring for your teeth, or your caregiver is, especially if you're dealing with a tracheal tube or a feeding tube.
Thank you. We have someone, Arlene says she's considering Botox for saliva reduction. Any advice or considerations on that?
Uh, I don't have an opinion. I I guess I personally utilize medications, oral medications, but I only use them at night. So I only control my salivary flow when I'm sleeping. Um, During the day, I want as much salivary flow as I can have because that's what's protecting my soft and hard tissues in my throat and mouth. And it's, saliva has a very important role in keeping us healthy and preparing our food for digestion, along with chewing with our teeth. Granted, when you go to a feeding tube, uh, that's a moot issue, but you still have the need for care of the oral cavity. But I don't have an opinion one way or the other for Botox. Um, I've certainly heard it being used for trying to do that, but I guess I would use it more for not showing wrinkles in my forehead, but I'm not that vain, so I don't care.
I will say we actually do use that a lot in clinic for excessive saliva. If you really have a lot and it's just too much. And more than once I've sat down at my desk and there'll be like vials of Botox just sitting there. And I was like, are you guys trying to tell me something? Why do you keep putting Botox on my desk? So if I
Yeah,
start looking younger, you'll know what happened.
there you go. Yeah. Like I said, I just don't have an opinion on that.
Yep. And that's just fine. Um, the other thing,
Well, I
oh, sorry, I didn't
go
hear you.
ahead. Oh, I think I covered everything I had on my uh, list. So, but I'm happy to answer any more questions.
Yeah, there are a couple more that have come in. Can you talk a little bit more about the medications that you use to reduce saliva at night?
Yes. Amitriptyline is a very powerful medication, and it also has some slight mood altering effects. But again, I only use it at night. Um, I have recently had Cymbalta added um, at my last team visit in UW Health in Madison, and but again, I only take those early evening when I'm expecting a normal night of sleep. The one thing that will uh, I become aware of is that I will have a very dry mouth in the morning. Um, and so the key is to take it early enough in the evening that you don't have a lot of dryness yet in the morning, and you get back to the normal flow by early to mid morning. So um, I forgot the name of Cymbalta, but the I just the baclofen is the medication that I take for my muscle spasms. And I like that because there's not really any negative side effects for me. So that I take during the day, but the other two only at night.
Helpful. Um, Arlene also says that so she was struggling with toothpaste because it was causing a lot of foaminess, and so she's been using mouthwash instead of toothpaste as toothpaste, and doing toothbrushing twice in the mouthwash. Thoughts on that, or if there is kind of a less foamy type of toothpaste, or what kind of, I don't know.
Yeah, there are toothpaste that aren't so foamy. Um, the thing I like about this brush is I only put a chocolate chip size amount on it, and um, and so the amount that I use is minimal. And if I feel like I need to reapply another amount, I'll spit out everything that I already had. So I'll break the brushing down into 4 quadrants, and uh, let the saliva that's and foam that's accumulated just fall out. So just I think slowing the process down and breaking it down into segments might be a way to get away from that foaminess. I would try some different toothpaste too. Um, like I said, if you talk with your oral uh, hygienist about gels and or toothpaste, she may or he may recommend a high fluoride small amount. Um, I I'll get the name of the type I use to Kat, and maybe she can post it as a follow up. But
Definitely. I can do that.
yeah, I think that's a wiser way to approach it, is with prescription toothpaste as opposed to this, over the counter toothpaste, because of the increased oral requirements because of the disease.
That's great. Thank you.
Sure.
Anybody else have any questions? I'm going to take off our spotlight view here so that if there are any other questions, one moment. So let me, just in case anybody else has one here. Okay, I don't want to miss anybody. All right.
Oh, I think
go ahead, Sandy, I see you. Yep.
Yeah. We all got, yeah, at the same time, Sandy.
Yep.
you're just muted right now, so you'll just have to unmute to ask
There you
it.
go. Perfect.
Do you have any recommendation on a good mouthwash? Do you have any recommendation on a good mouthwash?
Uh, they're all pretty much the same. I would recommend staying away from high alcohol content mouthwashes. A mouthwash is really more for just feeling of freshness. It doesn't have really a lot of cleaning capability when it comes to breaking down plaque accumulation. And so it's sort of along the lines of, using a water spray. It's it's okay at removing food debris and making you feel a little bit more minty fresh, but it doesn't have a great deal of therapeutic value, and is kind of how I feel. But if you're having uh, a feeling of mouth odors or unclean mouth, there's probably another reason for that. And mouthwash isn't going to solve that problem. That, I think, should have professional evaluation.
So now I'm just learning too, and I love this. So I've always been told to recommend antiseptic mouthwash because it kills more bacteria than regular. Is that wrong? It sounds like what you're doing. I've been lying this whole time, it sounds like.
Well, if it's listed as antiseptic, it has some capability, but the majority of mouthwashes really aren't antiseptic. Chlorhexidine is probably the only type of mouth rinse that's absolutely capable of reducing oral bacteria, but that's a prescription rinse.
Well, thank you for educating me. I appreciate it.
The same person.
All right. Oh, a couple of things just came into the chat. Okay, so Skip said, my name is Skip and I see Kate on every visit to my doctor. I'm 2 years into my journey with ALS. I eat almost nothing by mouth with all the meds I take. I have to do about 5 or 6 tube feedings per day. I brush my teeth once daily. I use a tongue scraper and a suction machine all day. I even choke on a sip of water. Biotin spray has helped a lot when dry. As for cheek biting, I would look at Dentec. He said professional mouth guards. And he also recommends a chin strap while sleeping to keep your mouth in a stable position.
Yes, I'm. He's further along in his journey than I am, so I went a chin strap to manage jaw movement, and hopefully that with oral guard of some sort to minimize damage during sleep. Yes, that's a good point.
The other question that came up is what about using baking soda as toothpaste?
The pH of baking soda is alkaline, so it does reduce the acidity of acid in our mouth. But baking soda is very granular, and if you're excessively brushing with it, that graininess can, over a long period of time, could cause some loss of enamel or stripping of softer tooth structure, like the cementum of the root of teeth if you have a lot of recession. But I think mouth rinse, with baking soda would be okay, but I would recommend against using it as a dentifrice because of how granular it is.
Thank you. Anybody else? I'm gonna go to my next screen. I'm not gonna miss anybody.
I know, isn't it exciting? We have 2 screens full of people.
I know, this is amazing. Dr. Botsford, you should feel very honored. I think this is our most well-attended group ever.
Wow.
You have
Well,
been.
it's only my second Zoom meeting in my whole life, so it was an interesting experience for me.
Yeah, you did fantastic.
Good. Well, I hope I helped.
Absolutely. I think this was fantastic. And
Good.
we will definitely send a follow-up email with a lot of these recommendations. Kent, I might connect with you to see if I can get a couple of those screenshots that you had. If you want to text
Sure.
me so that I can make sure we're sending out kind of the right recommendations. But otherwise, I think if we don't have any other questions, then you're welcome to stay on and continue. We're just going to do some kind of open sharing and check in with people, but you're also welcome to go, whatever feels best for you.
I may hang around for a bit.
Sounds good. Sounds good. Well, I think that I am just going to start out with.
Thank you, everyone.
Yes, thank you. So for those of you who may be new to
Phone
the group today, I am Kat, and I am a care services manager in the Madison, Wisconsin area. I'm also a speech language pathologist. So we Kate and I are kind of Wisconsin and Minnesota counterparts, and really enjoy kind of working, especially in the realm of communication and swallowing and all of those pieces. So I'm just going to start off, if you want to introduce yourself, give us a little bit of background and just an update on how things are going with you. If I call on you and you guys aren't interested in sharing, that is totally fine too. But, I am going to start with Mary Jo because you're first on my screen.
Hi, I'm Mary Jo Ames from Garner, Iowa.